Hello, and welcome to the educational module on the optometrist's role in promoting cognitive health through early detection. This educational program was developed by Cognivue. The learning objectives for today's program are 1. Understand the optometrist's role in the early detection of cognitive decline and its relation to vision through screenings. 2. Examine ways to identify patients who will benefit from cognitive screenings. And 3. Identify ways to seamlessly integrate cognitive screenings into the office's patient examination protocol. To understand why promoting cognitive health when it matters most is so important, we need to consider how we, as healthcare professionals, how our patients, and how the community at large currently think about cognitive decline. Today, most people think that all forms of cognitive decline are precursors to dementia and Alzheimer's disease. This is a misconception. As was discussed in Module 1, research has shown early detection and taking action can prevent, delay, or slow the onset or progression of cognitive decline. The other misconception that needs to be dispelled is that cognitive decline only happens as one ages, which is not always the case. Cognitive decline is not necessarily a normal part of aging. Making changes to certain modifiable risk factors at any age can improve our capabilities to process information and to preserve our memories, which is why early screenings to promote cognitive health at all ages is so important. You may be wondering, why bring cognitive screenings and the promotion of cognitive health to optometry? The simple reason is because patients are not getting screened when it matters most. Even though dementia and Alzheimer's has reached public health epidemic status, with 6 million people in the U.S. living with dementia, which is expected to more than double over the next several years, only 16% of adults report they receive regular cognitive assessments. This is where optometry's role in promoting cognitive health comes in. Many research studies have demonstrated good vision supports good cognitive health. Additionally, on average, optometrists see patients about once every 2 years. This high level of continuing care makes optometry a viable access point for cognitive screening, to establish cognitive baselines and conduct regular screenings to detect cognitive decline early when it matters most. By focusing on optimal eye health and providing patients with access to cognitive screenings, optometrists can play a key role in assessing cognitive ability, improving cognition based on visual intervention, and in early detection of cognitive decline. Offices can now provide cognitive screening to their patients in the optometric setting. With a Cognivue Thrive 5-minute screening device, staff can identify patients for screening based on various factors, and the doctor can link providing appropriate vision correction to promote cognitive health. Optometrists may also have the opportunity to counsel patients about the importance of early detection, treatment options, management of common risk factors and underlying conditions, proactively referring patients to a specialist when further cognitive evaluation and/or medical assessment is indicated. Another reason for optometry's involvement is the profession's focus on ocular health anomalies, including systemic conditions such as hypertension and diabetes, which not only impact vision, but also cognition. Various published studies have demonstrated the association between these diseases and their ocular manifestations, as well as their impact on cognition. Optometrists are already engaged in counseling these patients as relates to the importance of medication adherence and lifestyle choices. This places the optometrist at a unique vantage point to now incorporate cognitive screening as part of their clinical testing and counseling services. Optometry can utilize both cognitive screenings and the promotion of cognitive health to reinforce the importance of upgrading the patient's prescription to their best visual correction, so as not to increase their risk of cognitive decline resulting from blurred vision. Additionally, expanding your clinical services strongly differentiates your practice versus web-based providers, provides incremental revenue with immediate cash influx, and can fuel your patient acquisition efforts. When you incorporate cognitive screenings as part of your standard examination protocol to obtain baseline and regular screenings on all your patients, you are further demonstrating the importance of regular follow-up visits, not only to assess ocular health and refractive changes, but also to monitor changes in the patient's cognitive function. The importance of adding cognitive screening to regular clinical evaluations helps solidify the need for follow-up visits and leads to strong patient retention. Another benefit to your office is the expansion of your specialist referral network by the identification of patients for whom additional cognitive evaluation is indicated. Not only are your patients better served, but your practice becomes even more integrated into your local healthcare community. In having easy access to the Cognivue Thrive screening tool, and by adding routine patient screenings, optometrists can bring awareness to modifiable risk factors and promote appropriate specialist referrals, thus helping their patients achieve their optimal visual and cognitive health. Since the risk factors are vast and the importance of building and maintaining cognitive reserve is so vital, it is important to promote cognitive health. Studies show there are certain patients where modifiable risk factors can make a difference, including those with uncorrected refractive error with blurred vision, patients making poor lifestyle choices, those experiencing cardiovascular or metabolic issues, and those who have other medical or brain health issues. Through observation and assessment during patient interactions, optometrists and/or their staff can identify patients at risk of cognitive decline, such as patients who have less than their best achievable visual acuity at distance and/or at near, patients who are demonstrating difficulty moving around your office, or patients who are slow to react to questions or understand instructions. Asking key lifestyle questions during patient interactions enables the optometric staff to identify patients at risk of cognitive decline due to other factors. Patients with less than a well-balanced diet that is high in fat and low in antioxidants. Patients who are not getting the recommended 150 minutes of exercise per week. Patients not engaged with activities that challenge their mind. And patients who are not staying socially active. Optometrists often screen for and identify patients with metabolic disease, such as hypertension, hyperlipidemia, and diabetes, who warrant lifestyle intervention. Many studies have shown that these metabolic diseases play a role in cognitive health. It is well known that uncontrolled hypertension is commonly observed in the retina, affecting retinal function. Uncontrolled hypertension also accelerates changes in blood vessels in the brain, affecting our brain's ability to store memory. Hyperlipidemia, often observed as drusen, increases the risk of vascular cognitive impairment and vascular dementia. Even diabetes, also commonly recognized in the retina, has been linked to many forms of brain dysfunction, including mild cognitive impairment. Also, during pre-examination reviews, optometrists may be able to identify patients with a history of traumatic brain injury, those who have suffered a stroke, who have had a brain tumor, have neuropsychiatric disorders, and are taking anti-seizure medications, antipsychotics, or antidepressants. All of these patients are strong candidates for cognitive screening. The incidence of polypharmacy, patients with 5 or more medications, increases with age. As the number of medications increase, the number of drug-drug interactions can potentially increase as well. Drug interactions can result in a variety of side effects, including blurred vision, sedation, fatigue, confusion, dizziness, or even more life-threatening events such as increased cardiovascular risks. These interactions could be causing issues with one's overall cognitive function without them knowing. Optometrists can identify these patients for cognitive screening and referral to a specialist when appropriate. In summary, patients with self-reported cognitive impairment complaints or complaints from family members, patients 50 years and older with vision issues, and patients who want to establish their cognitive baseline for sports or work performance and have ongoing assessments to track any changes are typical candidates for Cognivue Thrive screenings. Identifying where Cognivue Thrive fits best in your practice and patient workflow is key to ensure the right patients are being identified and the screening program is successful in your practice. 3 potential areas where Cognivue Thrive can fit into your practice and patient flow are: 1. Immediately after the patient checks in, to avoid increased time in the pre-exam process. Conducting the screenings at this point in the visit would result in cognitive screenings being conducted on every patient. 2. The cognitive screening could be conducted during the pre-examination process by incorporating it with other objective diagnostic procedures. This enables selective screening based on your current patient intake form, which can be customized to include cognitive-related questions. And 3, which may provide the strongest benefit for both the patient and practice, is after the patient examination, with the doctor providing the rationale for cognitive screening. This provides the opportunity to reinforce the important link between cognition and best visual acuity, which should lead to higher patient adoption of an updated vision correction. As discussed, incorporating cognitive-related questions into your current patient intake form will help identify patients for cognitive screening, as well as for other services offered by the office. These questions can be customized for your office. Examples might be: 1. Are you as confident as you want to be driving a car? Have you had any accidents lately? 2. Ever wonder if you're optimizing your memory? Do you have difficulty remembering things such as names, birthdays, and where misplaced items are? 3. Are you as sharp as you used to be? Are you having more difficulty concentrating on tasks such as following instructions or creating lists? 4. Are you interested in maintaining and improving your athleticism in your favorite sport? Are you an athlete in a sport that has a risk of concussion? Developing a marketing plan for this new clinical service is also key to its success. Not only can Optometrists provide Cognivue Thrive screenings as an add-on or in conjunction with other clinical testing services, but Cognivue Thrive could be used as a marketing vehicle to drive new patients to your office. Because of its portability, you may want to offer free screenings at schools, nursing homes, community events, and health fairs. Cognivue Thrive can also be used to help identify patients for lifestyle intervention services you might offer, such as ocular vitamins and nutritional supplements to protect vision, and vision training techniques to enhance visual performance. Social media and local public relations will also be important tools to drive community awareness and interest in this new clinical service offering as part of total vision care. The key take-home points on this educational training program on the optometrist role in early detection of cognitive decline are: 1. Optometrists can play a critical role in promoting cognitive health through early assessment, vision correction, and by building awareness of other risk factors that should be managed and treated when it matters most. 2. 3 primary patient types may benefit from cognitive screenings: patients with self-reported cognitive impairment complaints, or from family members, patients 50 years and older with vision issues, and patients who want to establish their cognitive baseline for sports or work performance and have ongoing assessments to track any changes. 3. Optometrists need to implement processes to ensure the ongoing identification of patients for Cognivue Thrive screenings, such as incorporating cognitive-relevant questions on the intake form, assessing interaction with patients, and recognizing the cognitive impact of blurred vision. And 4. Implementing a marketing plan will help increase awareness and interest in this new clinical service. Cognivue Thrive is an adjunctive tool for evaluating cognitive function. It is not a standalone diagnostic tool. It can provide an advantage to the optometrist as an additional screening device to aid in the patient's overall treatment plan. This concludes the educational training program on the optometrist's role in promoting cognitive health through early detection. Thank you.